All right, welcome to MM&M Transform Talks. I'm Alexis, Wierenga, producer of the MM&M Transform Conference. I'll be moderating today's conversation on prioritizing the patient voice and what health communicators should know about the patients they speak for. I'm joined today by three patient thought leaders. I'll allow them to introduce themselves. So first, Tina.
Hi, my name is Aswani Omprakash. I'm a patient advocate. I have my own blog and social media platforms called Own Your Crohn's, ownyourcrohns.com. And I generally advocate for digestive diseases, specifically Crohn's disease, inflammatory disease, and a variety of others. And I really speak about how this affects our lifestyle, especially as minority women. I've noticed over the years that there's been a lot of faces that haven't looked like me, so I try my best to really speak up for my community, which is South Asian, as well as other communities, and give them a voice via my blog. I also work with pharma, digital health, nonprofits, basically the industry to help patients and help the industry understand the unmet needs of patients within our community.
Thanks so much, Tina. Tonya, could you introduce yourself as well?
Hi, I'm Tonya Cherie Hegamin. I'm an author and a professor of English at Medgar Evers College in Brooklyn, New York. I am mainly a patient advocate for type 1 diabetes. I also advocate for people of color with service dogs. My main focuses in my advocacy are asking for accommodation, racial disparity in the medical communities and within communities like type 1 diabetes themselves. I also advocate for LGBTQ rights and spaces in which LGBTQ people can communicate freely about their needs and visions for the future.
Thanks, Tonya. And Teresa, if you could introduce yourself.
Hi, I am Teresa Wright-Johnson, and I am, quote unquote, a heart that matters. I advocate in the spaces of both heart disease and multiple sclerosis. I was born with a heart defect, so this patient experience has been my life for my entire life. And I think my story is so powerful because growing up with disease, I watched my parents advocate on my behalf, and then thereby I learned to advocate on my behalf. And I just know that when we know what our needs are and we recognize the unmet needs in our communities that we serve, then I believe we have a duty to bring that forth and be change agents. So I write, I speak, I'm a public speaker, I'm a poet, and I just do it all. And just as our other two panelists spoke about, I also advocate for diversity and inclusion. Representation, it matters, and we are highly underrepresented in all areas. So until everybody can have a seat at the table, then the conversation isn't relevant.
That having the patient perspective there at the table, having people represented so they understand the health treatments they're given, it's all really important. So I greatly appreciate the three of you joining me today to speak about your work and specifically to speak to the MM&M audience of, made up of health communicators, marketers who talk so much about health all the time, and to have you speak back to them about the messaging and what actually is meaningful to you and what's helped you and where they've missed the mark. So just to give an overview, we're going to be talking, like I said, about the patient perspective today. And, leading up to our 2 days of live programming at the conference on September 30th and October 1st, I thought it would be really valuable to start with this patient perspective, starting off the conversation, hearing from patient advocates themselves share from their experiences. They're the ones who know best what actually works for patient outcomes. And so this is the opportunity for them to speak back to the health communicators. So to start off with, when you think about the people who are drafting communications, making advertising, telling you about new therapeutics or, resources for your health. What do you wish they knew about you and others with your experience and what you're going through? And Tina, we can start with you.
Sure. So thank you very much, first of all, for having me on this panel. But I think what I wished that marketers knew about my condition is that this is not just a Caucasian or Ashkenazi Jewish disease. This disease has been running in my family for a few generations now. And I think I was often not believed about the severity of my condition because I am of South Asian origin. So that's one thing. I would like to see more, like we've heard, representation, different skin tones, all types of races, genders, sexual orientations represented, because I know for a fact that many of our disease areas, and I know for a fact that inflammatory bowel diseases do not discriminate, and they affect everybody. So that's one area that I would like to see greater change in. But also another thing is with inflammatory bowel disease, you automatically think that it's a bathroom disease. So the person is living in the bathroom or living right outside the bathroom. To some degree, that is true. I think for a lot of us, we've had a lot of difficulty with using the bathroom and timing, our day around the bathroom and our outings around that. But it's so much more than that. And I think people really need to understand diseases like Crohn's disease are whole body diseases. This is not just a stomach ailment or an intestinal ailment. This is something where you develop all sorts of extra intestinal manifestations, eyes, the skin, the joints. It's affecting every aspect of your life. I live with chronic pain because of it. So it's just one of those things that I think the world really needs to understand with regards to my disease area, is that this is more than just a bathroom illness, and I would like to see that represented more clearly in our community.
Teresa, is, when you think about the marketing you've seen, to you, how have you responded to it? Do you feel like it actually connects or makes sense, or have they missed the mark?
My ask at every turn is, I need to see me. We need to see us. You can't tell me that heart disease kills Black women or women of color disproportionately, and every commercial, every information packet, everything I see, someone doesn't resemble me. That is powerful. It's key. And second thing I wish that people would understand is heart disease used to be this disease that was known to affect men only, or certain types of people, certain ages, or white males. And then, we started having more women being diagnosed. And then you saw, people of color being diagnosed. To say it again, heart disease doesn't discriminate. And I just wish that when a person walks into the doctor looks at the entire person and doesn't just make a judgment on what they believe. You listen to the person in their totality, you listen to their symptoms, you hear them out, and then you make an assessment. And third of all, when it comes to multiple sclerosis, I remember when I received my diagnosis and I felt so alone because, you just don't hear about people of color with multiple sclerosis. The only person I could think of at my time of diagnosis was Montel Williams. And, as I started advocating in that space and I started doing this work, I said, you know what? Women are being diagnosed significantly with this disease. So again, it goes back to the representation. If you really want to reach who you're marketing to, or if you really want patient based outcomes, then you have to have everyone's experience. And that is what I wish that people in the industry would know and would consider.
I mean, are there, immediately comes to mind of, what would be the best way to bring in the patient experience without putting the burden so much on the patients, but also are there better communications tools they could be using?
I'd love to talk about that as an English professor. I absolutely understand, writing mission statements, writing copy for specific people, recruitment, marketing, all of those things. And I think that, the traditional format is one thing. The storytelling format is another, but the real live work that whatever company is doing within their organization to reflect people of color, to reflect their mission statements about people of color and communities that are marginalized, that is what is most impactful. I, speak about this all the time because a lot of patient groups now want to hear stories. And as a storyteller, as a published author, I love stories. I live on stories. Make my life, off of stories. However, stories don't always imply or show action. And the actionable thing for these companies and organizations to do is to be transparent about the work they're doing within. And if I can trust you as an organization to be doing the work within yourself, I'm willing to go with you in a lot of other spaces. And I'm willing for those stories that, you want to tell, that I realize that you're not just doing lip service to us. It's really actually a part of the core of your organization. We love to talk about the customer is always right. That system of, we're catering to the customer. However, in these very precarious times, organizations should be looking towards intimacy, towards true connections that will last a long amount of time. I'm willing to be very loyal to a company that, maybe their product, and I'm speaking specifically about some of the technology that I wear every day, all day. I'm more willing to be loyal to a company whose tech might not work very well, but their customer service is on point. They make sure that, I am seen and spoken to as an individual. And that, the recognition that as Tina was saying, it's more complicated than just my pancreas. It permeates my entire life. It changes my moods. It changes how I can eat and how I can interact with people. And so, when marketing reaches that space of intimacy and connection, one-on-one connection, and I don't think that it's too hard. It's really about, discovering what language your patients or your customers are using. How are, having these conversations with us is one thing. Having more one-on-one conversations, having more patient feedback that is compensated. Let me say that too. And it doesn't have to be, it can be, very small. It could be a small gift card. It could be, whatever, but showing, the monetary, form of love energy is important. And, as a person who lives and breathes words, words do nothing without action attached. So I think that's my perspective.
Absolutely. And if you don't mind, Alexis, I'd love to add to that. I think in my sort of work with industry, with pharma, with healthcare marketing, digital health, what have you, I think what has worked really well has been like advisory boards of patients that they've set up, whether they're rotational, whether they're, for a couple of years, however it works, to really figure out what is it that the patient wants? So I sit on a couple of them for clinical trials with pharma. And in this way, not only do I address some of the marketing aspects, I address the diversity and inclusion aspects of the fact that, you know, clinical trials don't have as much diversity as they'd like, to really bring us the best care and to understand what the needs are of diverse communities. But also, there's another aspect to this, is how are patients being helped? Not only by this medication, but how are they being helped by the pharmaceutical company with patient assistance plans? So creating that bridge with advisory boards or task forces built of patients helps to create that bridge between industry and between patients. And I think when there's advocates involved in the mix, we can sort of bring that information, parse it through it, and bring it in a way that's sort of understandable, comprehensible to the average patient, so that they really understand, what is this medication doing, or what is this product or service from healthcare doing that will benefit me? So I think there really need to be like more ambassadors or more advocates that are working in conjunction, like Tonya said, compensated, because this is, you know, this is a huge time commitment. While it is a passion project for a lot of us, it is also a huge time commitment in addition to us dealing with our health and ordinary lives. So I think all of this really comes together, and the crux of this is really bringing the best care and the best products and services to patients.
Can I jump in? I second, third, fourth, fifth, everything that both Tonya and Tina has said. And I agree, advisory boards, steering committees, I'm on several, they work, they help. You know, we have our fingers on the pulses of our community, which means that when we come to the table, we come with knowing what's working, what's not working, what needs to be improved, what they can do better. And I believe that the period at the end of the sentence is that we need to humanize pharma and we need to humanize healthcare. We are more than just patients. We are people. And everything about our illness affects our daily activities. It affects our families. It affects our communities. And guess what? We are the bridges, oftentimes, to those who may not have found their voice yet, and the bridges to those who may not know how to approach. That's it.
No,
I will leave those pauses. I'm sorry.
that's all. It's all valuable. Thank you. No, and I appreciate, you know, building off of each other. I mean, like what you said, bringing patients to the table and making sure that when they come, the labor and emotional labor they're putting in is recognized and compensated. I guess I'm curious, you know, from your experience, have there been times where, I mean, is it curious that you say you'd be willing to use tech that works maybe not as efficient, but you get better communication? Have there been times in your journey from, I know some of you have been walking through this your whole life, but you know, times in your journey where something new has come and you're like, I don't understand this at all. This isn't being communicated to me. And it's not just maybe doctor-patient, but also the language doesn't fit. It's like they don't quite understand how you're actually going to use their product or medication in your life. Like, can you share a little bit about those experiences of where there's been a gap and really good communications could have helped you there or guided you? Sorry, do any one of you have any starting thoughts on that?
I think
Probably all do.
I don't mind starting. I think with some of the digital apps, there's definitely been confusion about how they work. There are a dime a dozen now, and at least I can speak for the inflammatory bowel disease space specifically. What's tricky is that they require some daily time commitment of what your symptoms are, what you've eaten, how many times have you emptied your ostomy? I have a permanent ileostomy bag. So how many times have you gone to the bathroom? All these kinds of things. And this is like a lot of work, for lack of a better phrase. It's a lot of work for the patient to take on. It's also triggering to have to remember every little thing, especially when you first sign up for some of these digital apps. So I think that there needs to be a way to sort of bridge that gap for patients as well. If there could be maybe an intake by a person who can be compassionate, and rather than an app intaking that, and we're feeling frustrated because there's no one actually talking to us about it. So wondering about that, and I feel like a lot of patients, even though so many apps keep coming out, a lot of patients hesitate to use them, even though they might have ambassadors and advocates attached to them, because it's triggering while it's value add and provides knowledge through content of different bloggers or different patient advocates. It's still a lot of work for them. And it almost feels like, what? I can't monitor my daily symptoms without losing my mind. So I think that there really has to be more of a value add sort of depicted to us and described to us, especially when it comes to some of these digital apps.
I can add that, there's always a lot of information for diabetics. Like diabetes is like over informationalized sometimes, yet it still doesn't get to people, right? It still doesn't always reach, people. And sometimes there's some information that gets regurgitated, yet, things like the fact that type 1 diabetes is an autoimmune disease does not get, circulated, or that, type 1 diabetes is not only for juveniles. That there's really more research now that, diabetes is a continuum and very complex. There's not just one or two types, there's multiple types. So there's some information that I think that's just old, that gets circulated and gets regurgitated often by educators, that doesn't really address what questions that the actual patient is asking. There's, like Tina said, advisory boards and communications between patients and, even customer service has to be, so crystalline. It has to be distilled. It has to be about, not just asking, the same questions all the time, but recognizing that some problems happen frequently. So like if I have a pump that's disposable, that, if I get 10 in a box and 4 of them don't work, I don't want to sit on the phone with you and tell you 4 times what happened for every single pump that broke or didn't work correctly. So the repetition is something that I think companies can really start to, look at. And what is it that's new that needs to be, told to their patients? What kind of information, like you said, like using an app is great, but the reality is that, besides games, people aren't always using apps frequently. They don't have time to constantly be monitoring those things, even though sometimes the apps are for constant monitoring. So there does have to be more personable, accessibility for patients. And what I was saying about customer service sometimes trumping, the actual technology. I was just speaking last night about, access and accessibility and, the time and energy that goes into monitoring and living as a person of color. First of all, for me as a queer person of color, a queer woman of color, then, with a disability, like at the end of the day, I'm just sort of like, what happened today? I don't know. So there's got to be a way of, really sort of creating quicker access for like setting up things. I know that for myself with setting up my constant glucose monitor, I was not trying to, although, I might not like go to an app to, do all the things. I certainly did look up on YouTube who is doing what, because a quick video by a patient was more, gave me more resource than going through the CD that they sent me that was just too slow. I had already seen it. I saw someone do it. I heard their perspectives and I was like, okay, I'm ready. So I think that there's, multiple ways of, augmenting things like apps, augmenting, even virtual trainings so that it connects patients with patients and patients having loyalty to these companies. I think it really promotes loyalty. So I think that that's an important thing that, some of this technology and a lot of the jargon, it doesn't instill trust. It doesn't instill like, oh, we understand what you're going through. This is a pain in the butt, and, but we're here for you. We're here in this together. We're doing it together. This is for all of us. So I think that there's, some ways that directions, it's like I don't want it to be like like trying to put together furniture in IKEA, like I want a little bit more intimacy, for something that really that speaks to literally my life or death.
And just to add to that, I believe the apps for whatever disease space should be efficient, just like we all said, because days and minutes go fast. So we wanted it to be efficient. We want it to be culturally competent. That's huge. And when I say culturally competent, I mean in all areas, race, gender, age, everything. Because we each respond differently. So these are things that must be considered when we talk about applications. And just as both Tonya and Tina stated, managing, thriving, surviving with chronic illness and illnesses and chronic pain, it takes a lot. It does. And then when you have life itself, you have all of these things chronicled together, it's a lot. So yes, apps are useful, but how useful are they? They have to be, as Tonya stated, intimate. They have to be effective. They have to be efficient. And there's something about them that has to identify with me, the user.
Thank you. I'm looking at the time now and I'm seeing that we're starting to kind of hit that 30-minute mark, and I don't want to keep you too long. But I do just want to do a final round of, thinking about the context now of being in quarantine, and, lack of maybe in-person access and having that, face-to-face humanizing experience and being kind of forced to use all these tech tools, I mean, for better or for worse. But I'm just curious, if you could have like one final thought to give to health communicators, people sharing these products, trying to do telehealth, communicate with you via telehealth right now, what would be your, closing note to them? What do you want them to know about, what you're navigating right now and how they can actually be a helpful resource to you?
I think I don't mind taking that. So something that I've been doing these last few months, a lot of, is having different companies, even ostomy manufacturers, digital health, pharma, reaching out, hey, can you talk to our staff? 300-400 people over Zoom or Google Meet, whatever. Can you talk to our staff? Help us build morale. Tell us what we're working so hard towards. And I've sat on panels, I've done them individually with different groups of people, different disease areas, or just by myself. But what this has done has not only helped to rebuild some of that morale within the company, it's helped create that intimacy that Tonya's been talking about between patients and the company themselves. If the company understands what the patient is going through at this time, whether it be via telehealth, whether it be via, their issues around their chronic illnesses not being managed as robustly as before because, look, there's a larger crisis here at large that we're dealing with. Whatever the situation is, I think that this helps to create an understanding between the company and the patient so that they can provide the best services. I'll give you an example. There was an ostomy manufacturer who asked me to speak a couple months ago to about 300 or 400 people. And this was around the world. The reason why was not just to boost morale, but to really understand what I do is I advocate not only for minorities within this country, but there's a lot of Asian and Latin American population who reaches out with inflammatory bowel disease to me. Trying to understand, trying to glean that education and sort of avoid those misinformation traps online on Dr. Google. So a lot of patients reach out from international locations. Guess what? There's been a huge, huge shortage of supplies, ostomy supplies around the world. Patients don't know how to get them. The demand is up. The supply is down. The prices are skyrocketing. A lot of these countries don't even have their postal services active during a lockdown. How do they get access to such a vital medical device? Right. So these are things that I was trying to tell this company that we need to bridge this gap for patients because I'm hearing from them and they can't access something that's absolutely vital. How do you live without an ostomy bag? So I think it's really important for companies to start reaching out to different kinds of advocates of different diverse backgrounds, get their opinion, get them to talk to the company about what's missing, what's needed, also help boost morale, also help show them, look, this is the difference that you're making in our lives so that they can work robustly as a team to bring us the best solutions possible. Because COVID-19 isn't going away anytime soon, right, as far as we can tell. So let's work together to sort of bridge that gap. That would be my piece of advice.
In terms of, so one of the things I love about my current endocrinologist, and I love her, one of the first things she asked me, not the last thing, but the first thing she asked me is, what do you need? That is like, sometimes she asks me that and I see her every 3 months. So sometimes she asks me that and I'm like in tears, Sometimes she asks me that and I'm, like, hey, I don't know what you got, asking us, that really goes off of what Tina was saying, asking us, what do we need first, and not just how can I help you, but what do you need? There's so much need right now. There's, and not that every company is going to be able to address every single need. And my doctor says, okay, well, we can do this, this, and this today. Another time we might need to do this, or you might need to email me about that. And we create a plan based on my needs, not just service. We're all feeling a lot of feelings. We're all, constantly bombarded by, so much information and, new ideas and, facts that we never knew. Having a medical community or a medical technology or any of these groups, having them ask me, what do I need, is paramount at this time. And, of course, you can't expect that everybody even knows what they need. Sometimes we don't know what we need, but creating a system in which, needs of the patient are asked for first and then incorporated into, plans and actions, and budgets, it really does, like I said, the intimacy matters. it also creates a level of trust. You know, if I can trust you to make a plan, not to make promises on what, you know, what you want me to do or you think you can do, but to make a plan for it, that's realistic. It shows that you understand that my experience as a human is nuanced and it's complicated, and that, you know, your company is searching for my input, even if it's in even small ways, you know, and specific ways. What do you need for X, Y, and Z? I love, you know, the idea of patients, you know, talking to workers who are making products for people. How can that, you know, we love the commercials where we see the Amazon workers, you know, talk about how their kids, you know, see, you know, mommy and daddy in the truck, and they, you know, that connection, that building, that sort of, you know, connection with the worker, the person who, you know, you're less, you know, you're not as mad when you're, you know, whatever from Amazon doesn't come in when you see those commercials. And, you know, we recognize that not every company can speak to every single, you know, patient, and not every patient really wants to be spoken to. But, you know, you have 3 people here, and if there's 3 people, there's 30 people. And, you know, I think one of the things that, you know, companies, there are certain things they don't want to hear, and that's okay. They have to recognize that sometimes, you know, they're not going to get the information that they necessarily want in that moment, but they can create relationships with people who, you know, can give them some, you know, some small part of aspects of what they want, and what they need. I think that, you know, the smaller organizations actually can have a chance to do even more with that, because it is a family atmosphere. And when, you know, you make your family, your customers, and not just, you know, those of you who work in an office or in a factory, then there is more sense of purpose. There is more sense of connection. More and more these days, we're looking for connection. You know, we're looking to just have a conversation with someone that doesn't make us feel terrible. And I think there's a lot of space for that to happen. And, you know, patients can be trusted to give our opinions without disparaging or bringing people down. Because sometimes I think that too is why patients don't get talked to, because, you know, they're expecting the sad story, they're expecting, you know, anger or dismay, and some of that might come out, but it's got to be okay, you know, and it's got to be like, okay, well, how are we going to move forward? You know, where can we, you know, what positive, you know, outcome do you, even if it's that you can envision, not that, you know, even that can happen, but that we can envision together. That is where, you know, the power comes in for not just the patient, but for the product and the company itself.
This is the prime time to collaborate. Tonya, you said something so powerful. Your doctor said, "What do you need?" My doctors ask, "What do I need?" Also, equally important for me is, how are you? This is a tough time right now. It is. How are you? And from what do you need and how are you, that builds a foundation for conversations. It builds a foundation for projects. It builds a foundation to assess needs. It just builds and lays a solid foundation. Just those 2 questions. Who best to ask them to are your patients and advocates. That's how we move forward through this. And that's how we continue to move forward. Connection, intimacy, honesty, authenticity, those things matter. Because I think, as we've all stated, words are words. What's next?
To have your perspective and your honesty has been so meaningful today. So thank you all for your time. I am very grateful for you taking the time to be a part of Transform Talks.